Before walking out your door, I want you to think to yourself, where am I going? What do I need to go get? Do I really need to leave my house? Is it essential as to why I'm leaving? If I go out now and get exposed, who would I potentially be exposing back at my house? These are the types of questions we should be asking ourselves before we decide if we need to go out or not. For approximately 1.5 months, many Americans have been practicing social distancing due to the coronavirus pandemic. Just within a month, businesses and schools all across the country have shut down due to the coronavirus outbreak. Colleges have canceled classes or even started doing online courses for the remainder of the semester. The President of the United States and governors all across each state have started issuing stay-at-home acts to try to keep people from being out in the public to try to control the spread of the coronavirus. The point of my speech today is to persuade my audience as to why it's important to stay home during these unprecedented times. I have done research over COVID-19 to help me with my speech. At this exact moment, we're all going through something that we've never gone through before. Many public officials and the Centers for Disease Control and Prevention have expressed their concerns as to why it's important to stay home during this pandemic. So today I will be discussing what COVID-19 is, how it's spread, and why it's important to stay home. So let's take a look at what the coronavirus is. On February 11th, 2020, the World Health Organization gives the coronavirus the official name COVID-19. In its full form, COVID-19 stands for Coronavirus Disease of 2019. This strand of coronavirus has not been identified in humans before this outbreak spread worldwide. The Centers for Disease Control have put on their official CDC website that the COVID-19 is a respiratory illness that spreads from person to person. Symptoms include coughing, fever, tiredness, and difficulty breathing. Severe complications include double pneumonia, multi-organ failure, and even death. As of April 18, 2020, the CDC has released that there are 2,293,644 cases worldwide, with 723,729 cases being in the United States, and 157,400 deaths worldwide, with 37,841 deaths being in the United States. As you can see, many people around the world have been affected by the coronavirus, whether they have it or not. For example, many hospitals are in short supply of gloves, face masks, and ventilators. Many people are out of work and struggling to make ends meet because of the virus. And many essential workers are working long, hard hours and even putting their lives on the risk by being exposed to the virus. Andrew Pekis, a professor at Johns Hopkins Bloomberg School of Public Health, and the CDC have stated that there is currently not a vaccine for the virus, and that there is no one in the human population that has any level of immunity to the virus, making it susceptible to 100% of all people. Now that we have looked at what COVID-19 is, let's take a look at how it spread. According to the World Health Organization, a specialized agency of the United Nations, reported that China reported on December 31st, 2019, a cluster of cases of pneumonia that spread across China that was later discovered to be the coronavirus. From there, the virus has spread from person to person worldwide with over 2 million cases. The CDC has informed the public that someone can be infected by coming into close contact with that person. You can also be infected by respiratory droplets from an infected person by them coughing, sneezing, or talking, or touching a surface or an object that has the virus on it. Because being in a close contact and the virus being easily spreaded, closing schools and non-essential businesses has been a smart move to help lower the spread of coronavirus. This is also why many stay-at-home acts have been put into place to try and get a handle on spreading the virus. Jerome Adams, a Surgeon General, spoke out to NBC News on April 5th to call on U.S. governors who have yet to issue the stay-at-home orders in their states to give healthcare workers at least 1 week of restrictions due to the upcoming acceleration of cases and deaths. Now let's get into why it's important that we should stay home. The incubation period for the coronavirus is 2 to 14 days, meaning this is the time from the second that you are exposed to the moment you start developing symptoms. So let's say you decide you want to go out one day, and when you're out, you get exposed to someone who's infected with the virus with no symptoms. You can still be infected with the virus without knowing. So the next day, you decide you want to go out again, but this time you pass by 6 different people, and before you go home, you decided you want to go visit your mother who has asthma. 8 days later, you begin getting symptoms, so you get tested positive for the coronavirus. Because the incubation period can be up to 14 days, you could have potentially exposed the 6 people you passed and your mom with asthma. And those 6 people could have exposed anyone else that they were around as well. Elderly people and people with asthma, heart conditions, diabetes, and more are all at a higher risk of severe illnesses for COVID-19. This virus spreads much easier than any other common illnesses and can be spread without physical contact. There is no known cure or vaccine for this virus, so making self-isolation the biggest defense by staying at home and away from others so it can reduce the spread of the coronavirus. If everyone stayed home more during this time, the faster the virus can stop spreading from person to person, and the faster we can get back to our normal lives. Even the CDC and President Trump have all encouraged everyone to stay home and social distance as much as they can. By now, you should have an understanding as to why it's important to stay home during this time. Only go out if you have to. Staying home isn't just for your safety, but for those who are around you. With no vaccine and the acceleration rate of the COVID-19, we are living in a confusing and scary time, but it's up to us to do our part to help stop the spread of the virus. Once we can get a handle on the virus, our country can reopen again.